Aloha, it's Chandler Rose, and today we're doing a massage instructional video for knee pain. I have Abby here who's spoken to me about having a car accident impact her knee. So this is also really good for recovery from car accident impact. And that can create a twist in the leg or a twist in the hip, which takes a while to get over. So let's start with just relaxing the legs. I like to take a little time to just take some slow, deep breaths. When you have knee trauma, sometimes you can feel it in your low back as well. Most of the time when I hear low back pain, I like to work on the hamstrings, legs, and touch in on the knees. Those joints have a pretty big relationship, so it's good to always try to do your work with the intention of connecting everything and not just working in parts. It's kind of easy to feel that way when you're doing a section of a video that's just covering a body part. So definitely do some low back work as well anytime you're working on leg issues or imbalances. So I like to assess where her sacrum is, how her neck is. Elevating the feet is really helpful for prone position that can take pressure off the back and allow the knees to relax. Sometimes you're going to have a situation where the knees are a little turned in or maybe turned out, depending on how the body is healed. I'm going to warm up the muscles and skin and fascia with some really lovely essential oil butter that I make myself. I like knowing exactly what I'm putting on the body for myself and for my clients. I know that for leg videos it's really hard to see some of the side angle, so I will repeat what I'm doing on this side on the other. You can also just listen and feel out where the leg is on your person you're working with, because everybody's body is different. So just take this information in, but also apply it and be flexible. Be willing to change the work for that specific person. So you have the IT bands, and then you have the structures around the knee that connect in on the sides. Those are the lateral sides of the leg, here and here. You also have popliteus, which is a muscle on the back of the knee, which can be really sensitive. And then you have the hamstrings. And even someone that isn't complaining of leg or knee pain, maybe they just have low back pain. It's really important to loosen the hamstrings because that will give the legs a little more mobility and flexibility into the low back. So I like to take the heel of my hand here and glide in towards the sits bones. And the sits bones are what we sit on, where there's a lot of attachments happening. You can also go all the way down into the forearm, which I don't know if it's easy to see that, but I'm taking my arm at an angle and working up, lengthening, static pressure. And then for the IT bands, I like to really ground into my feet. You're in a lunge position. You want to be able to move back and forth easily. And then I just like to ground into my arm here and then push in towards the side of the leg. Making sure to breathe. Your initiating breath will also remind the person you're working with to breathe. Sometimes I push my elbow into my hip just for more stability. And the IT bands, these areas of this tense fascial tissue can be really tender. So be careful about pressure. Abby, is that too much pressure? Okay. I'm also careful of my wrist. I know that a lot of times with massage we're pushing from our base and we're moving energy this way. But with the IT bands, I like to just do a little more myofascial work, and I'm kind of pushing straight in, like grounding with my legs, using my body. I had an important, wonderful, lovely teacher that taught me. She said, be lazy sometimes in your massage. Not lazy in your mind, but almost like you want to be comfortable in your body. So use your posture. Instead of just using your hand strength, that's really how you do this for a long time. I've been doing pretty deep sessions for about 17 years, full time. So I haven't had a problem to this point with my hands and wrists. And I think a lot of it has to do with my ability to be lazy in my massages. So just getting comfortable and using the base. You don't always need to just use hand strength to loosen the muscles. So you can use a drape, or you can use, maybe you have someone that has yoga shorts or a bathing suit. You can get creative with draping. A lot of what we do is more about so you can see the work, so you can learn it. So it's not necessarily what we would do in a professional setting, like at a spa, but this allows us to share instruction and technique in a way that you can see it and try it yourself. So I'm going to take one hand down at the foot and then one hand in the crease of the knee, and I'm just going to lift her foot up like this. And part of me is feeling any sort of resistance. Also, if you take the heel towards the sits bones or towards the glutes, you're offering a little more stretch in the front of the leg, in the quads. It doesn't have to be much, but someone that has like a knee injury, you might notice, there's like a lot of resistance. Be really careful about overstretching someone with a knee issue or impact, because you want to know when that happened. You don't want to do it in that first couple months. So I have I have the foot cradled in my hand, and I'm using the heel of my other hand, just going up the leg, doing a little stretching here. Feeling the rotation in the knee. Feeling any sort of resistance here. And then, depending on your height, the length of the leg, You can use your shoulder as a place for the foot to rest. And I'm taking my hands and pushing down into the knee. And if you're comfortable with it and your client is comfortable, you can use your thumbs a little more specifically, making sure to breathe. I like to tell the people that I work with, if they don't feel like talking, they can use the breath to communicate. If it's too much, maybe they take a real deep breath and I know, okay, we're doing this, but maybe I just slow way down and let them breathe through it. You can figure out whatever signals work for you. Just taking my thumbs into the crease of the knee, allowing a little more circulation, even connecting the mind with the back of the knee, something that we might not even think about unless there is an injury there. And then I found a little spot here, so I'm going to stay there. I'm going to let the foot drop carefully towards the table. I'm doing a little deeper pressure here. Is that too much pressure? All right. You can stack your thumbs. You want to be careful of the joint around your thumb. That's can be a tired one. So if you're not comfortable with using your thumbs in this position, it's okay. You can stay more into the Swedish realm of just warming the tissue. All that will be helpful for the recovery of the knee and the connection of the relationship between the foot and the knee, the ankle and the hip to the back, or to the other hip, the back to the neck and shoulders and the top of the head. Just bringing your awareness to how it all relates. Where does it feel like there's more holding happening? And I would also ask, is there one knee more affected than the other before you start? You know, if there's a really specific, a lot of people I work with have surgery on a knee. So you're working with maybe the original injury and then the recovery from surgery as well, which can just be really dense scar tissue. You're opening, you're giving them more mobility in the leg. Scars can heal in all sorts of ways. So I'm just warming her hamstrings up and approaching some of the lateral muscles. You can work into the lower leg a little more if you'd like. For the sake of showing you this again, I'm going to move to the other side of the table. I'm now working on the right leg and knee, addressing some tension on this side due to impact in the knees. So I like to take a look. Each leg is different, angle is different, the way the foot angle is, and ankle relationship to the hip. It's all special and individual. However, doing this work on one side, the body is sort of integrated some of the information. So sometimes you get to the other leg and there is more openness happening. Kind of like a dance move. You learn it on one side and then maybe the other side's easier. Maybe not. That's how it is for me, at least. So warming up my oil. I love organic essential oils for doing massage. I feel like they are plant helpers that assist in loosening and opening and shifting the energy. Also, many of them are really good for reducing heat. And when you have injury, you're going into those hot spots or places that are maybe cold spots that haven't moved in a while. Maybe you're working on a scar. Sometimes scars can be really hot, sometimes they can be cool. Swedish, warming the tissue is good for circulation. It's good for you to be able to assess where you feel tension, where you feel tightness, where you feel the injury. At this point in time, I can actually picture an injury, especially if I've heard the person speak about it. I can really picture it. So be careful as well when you're working with impact in the knees. It's a lot of ligaments and nerves that are involved, and you can pick up that information. So sometimes I work on a knee that has very specific memory, and then the next day I'll feel that in my own knee, which is always just interesting, even though it happens a lot. So notice how you're standing. You want to really be comfortable. You want to make sure you're grounded in your feet and you're present in the moment. Something with Lomi Lomi or Hawaiian massage is that you're always honoring the moment, and it sounds like such a simple way of working. However, it's really easy to get used to doing massage and then be thinking about that you need to pick someone up later, or maybe you need to make dinner, or whatever is on your mind. Try to be with the person, because then you're really feeling their stuff and you're supporting where they're at, and then you don't go too deep, or maybe you do, but you can communicate that. So I'm gonna put one hand at the crease and just kind of feel how this leg is feeling. I'm gonna go a little into that IT band on the side, grounding with my own side. Some of this is a little abbreviated so you can just see where I am. So it's okay to face the table, like head on. You can really keep your body at the side where I'm kind of positioned a way that you can see me moving through the leg. Change positions to your own body and to the body that you're working on. You don't want to be holding your wrists in a really tight way. Use a little stacked pressure with my thumbs here on the side of the connections. Breathing. This is not necessarily comfortable work to receive when you're doing specific work with your thumbs. But I love when it's over for myself. When I get it worked on, I'm like, wow, that's really sore. But then when it's over, all of a sudden I feel like my leg is like thanking me. Like, oh yeah, thank you for, just loosening those little areas around the knee. Now my joint can move, and my whole body feels better when my legs feel better. My legs feel lengthened. My back feels more relief. Is that too much, Abby? Okay. So you can pick an area, or you can make this really open as far as communicating. It does make it easier to use a really nutrient-dense oil because the tissue is kind of just sucking it up. The skin is absorbing a lot, so you're getting more mobility and softness in the adipose layer. A lot of myofascial people, or NMT, neuromuscular therapy, specialists will work without oil in the leg, and it is a very fiery kind of feeling, and it's okay, it's really good too, but this is kind of the easy way, this is the more lazy way, the relaxed way of doing this. So I'm gonna lift her leg on this side and just feel, I'm thinking about where the connections are in the quad, which is the front of the leg. I'm also thinking about where those connections are close to the front of the knee. Like, is she feeling more stretch in her anterior hip? Is she feeling more stretch near her knee? Every person is going to vary depending on where they have an injury or tension. And for this, I'm going to actually just balance on the table a little bit and give her a little pressure into those hamstrings with her foot kind of cradled near my shoulder. Anytime you stack your hands, you're dividing the pressure between both hands or thumbs, same thing, same idea. You're helping the other thumb. Maybe you have a dominant hand or thumb you like to work with. You'll figure that out. And then Hawaiian Lomi is all with the tool, which is the forearm. It's a really nice way to just do a little opening. Again, you can stand right on the side of her facing the opposite wall. I'm just kind of at an angle so you can see me getting in there above the knee. Go in one more time on this side. I haven't really worked inside of the leg into the adductors. You have the abductors or abductors that will allow your leg to come out towards or away from the midline. Your adductors or AD, D as in dog, are on the inside of the leg. If you have knee stuff going on, I would do some adductor work, but I would save that for later because that is typically more tender. It's a very vulnerable area working on the inside of the leg. So more advanced kind of work. Down back into the lower leg, into the foot, sweeping up. You can always come back with just a few. More for stability, just placing a hand on the crease of the knee, one hand on the other foot, connecting in the other leg. Thank you so much for joining us today. I hope your knee or knees are feeling much better, and I look forward to seeing you soon. Thank you.
If you enjoy these videos, please join us at PsycheTruthPatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit PsycheTruthPatrons.com.